Can an old drug for malaria be the winning weapon in the war on the coronavirus? Plus, drive-through COVID-19 testing has arrived here in South Central Kansas. And just how quickly is the virus spreading in our state? What does it all mean for you? That's what we're talking about right now on Kansas Week.
Southwest National Bank has proudly served Wichita and its surrounding communities for over 100 years. We are happy to support KPTS, Public Television for Kansas.
I'm Pilar Pedraza, and this is Kansas Week. As the pandemic continues its spread in Kansas, we continue to try to answer your questions about what's happening, what to expect, and how to stay safe. Let's start with a look at the latest update from the state as of recording time. As we take a look at the latest numbers, the state shows a total of 202 positive tests to date, 203 if you include a last-minute positive test in Sedgwick County. That's compared to more than 3,200 negative tests. Of those who've tested positive, 27 have had to go to the hospital at one point or another, though many of those are now recovering at home. Now, if we take a look at this map, you can see how the virus continues to spread. A week ago, it was mostly just a few counties in eastern Kansas and here in Sedgwick County. But we are now seeing cases as far west as Gove County now. And here, this graph shows how the positive tests are increasing each day. The last couple of days, we've seen about 30 to 40 new positives a day. KDHE Secretary Dr. Lee Norman said on Friday he expects known cases of COVID-19 to peak out in Kansas around April 24th. If that holds true, he says, Kansas should have enough ICU beds for everyone who needs one.
If we say that April 24th is the peak day and then it'll start leveling off and going down, on that peak day in the Kansas City metropolitan area, we're only down behind, if you will, by 35 intensive care beds. 35 we can absorb in the system. As one of the critical care docs said, we do that all the time.
And joining me this week to discuss this and more on the desk, practicing some social distancing, we have Phil Journey from the district courts and Pete Meitzner, chairman of the Sedgwick County Commission. And via Skype, we are also joined by Dr. Jeff Colyer, former Kansas governor and head of the National Rural Health Commission. Let me get that right. So we've got a lot of things to unpack here with what's going on. And as we look at these latest numbers, we're seeing a constant increase. And Jeff, I want to start with you as a medical doctor. What do these numbers really tell us?
Well, for starters, these are just sample numbers. These are the people that have an actual positive test. And as you're looking at that number, in many ways, that number may be, in terms of the entire environment, may be as high as 10 times as many as reported there, because many patients have not had the opportunity to be tested. And we're going to see that number across the United States being something like 10 times the actual number that we say are tested may actually be positive.
And that is a big reason, Pete, why we're practicing, why we have the stay-at-home order here in Sedgwick County and across the state urging the practicing of social distancing.
Yes, and Pilar, thanks for having us. There's a lot of information coming at us, and we were kind of leaning a lot on what Johnson County was doing, because they were, I don't know if you want to call it like Jeff, 8 or 10 days ahead of us, but they were ahead of us, and they were taking actions, and as a population center, we thought that we should get more aggressive about incorporating those, and that now that these numbers are starting to spike, we're trying to keep people distancing from each other while this is going on, and that's what that was all about.
No. And I know that right now, Phil, the courts are closed, sort of. Where do we stand there?
Well, there are a number of operations the court continues to maintain. For example, first appearance for individuals arrested for crimes, processing through the jail. Right now we're scheduling things out about 60 days. We still continue to do things such as protection from abuse and protection from stalking, emergency orders, there are lots of people that had court dates that we're trying to accommodate, and so there's still a lot of people in the building and working, but we're trying to restrict public access to the building and limit it to the minimum number possible so we don't turn the building into an infection vector.
And that really is a concern because we do have a lot of exceptions to the stay-at-home order. I read someplace that it's about 40% of businesses in the county that fall under that exception. But at the same time, Jeff, I'm going to turn to you on this one. Dr. Norman, the KDHE secretary today, was saying that they've seen about a 40% decrease in the movement of people by following GIS, GPS tracking of phones. So it is working to a certain extent.
You know, we're getting smarter every single day, and that's what's really important about this. That's how we're going to get through it. And we're going to be doing things a lot differently. I wouldn't be surprised if in the next few days you see a much stricter statewide stay-at-home sort of order coming up here in Kansas. And we're that in several other states, and I wouldn't be surprised if those happen here.
Yeah. Well, certainly, I don't know about you, Pete, but I have gotten a lot of calls in the last few days of people complaining that with the stay-at-home order here in Sedgwick County, folks in Sedgwick County are just heading over to Butler and some of the other nearby metropolises to get their hair done, their nails done, etc. Get those services that they can't get here right now. Kind of seems to defeat the purpose.
Well, it is. We communicated our order to the adjoining counties, and even the Wesley and Via Christi hospitals had asked, as a regional hospital, they have a lot of patients, but they have a lot of coworkers that live in, with Andover being right there as part of Butler County. It was important. We've communicated to Butler County to see if they could do similar, but it is up to them and their medical person that's in charge.
No.
So, but you're right. The logic is Dr. Colyer would probably say is some of the things are obvious. You know, hairdressers that have their hands in somebody's hair for 30 minutes. I mean, it's stay distance. You know, if you're too close for 10 minutes, you got a good chance if somebody has it. Well, something as obvious as hairdressers, things like that, is something that's an obvious one. Others are less obvious. But
for our current situation to work, it requires a social conscience that people make the conscious decision not to violate the order. Because right now, the orders that are in place have no teeth. They're just kind of like advisories. It's not like it's a quarantine order that, you know, that is one of the functions that will operate in the courts, is a quarantine court if necessary to actually put people in custody for violating those orders. And so unless we want to be like New York State, we have to abide by these orders and accept the personal inconvenience that comes with protecting our community, because you may be infected and you may be feeling fine, but you're out there giving it to people that are my age. He's too young. But, you know, giving them to people my age that have a pretty high mortality rate.
Yep.
Well, the interesting thing is that while there are some folks, and I've heard from plenty of them, who say we're going overboard on this. It's too far. It's really not that bad. It's not that much worse than the flu, which the statistics you and I have looked at both. We've talked about this before, Bill.
They are so wrong.
It does not hold that theory up, but a lot of people believe that. At the other end, there are a lot of folks who think we haven't done enough. We need to go further with the next step. With a statewide shutdown, and we need more testing. Even Dr. Norman has said we desperately need more testing. Now, we do know that some is coming here. Due to the shortage of testing kits, there has been a concern among many in Kansas, but with commercial labs coming online this last week, that shortage is starting to ease a little bit. And as Kake's Jackson Overstreet shows us, at least one medical center has started drive-through testing this week.
Cars lined up one after another at a drive-thru, not to grab a quick meal, but to potentially get tested for COVID-19. Grace Med is offering drive-thru testing to the public, and we spoke with one of the people who did it.
It was a very easy experience. So if you feel like you need testing, you need to contact your doctor. You really do. It was a very easy process. They were very, very friendly.
The clinic has been offering the drive-up test to the public since Monday after they practiced it with some of their own patients. More than 20 people have gone through so far.
The drive-through testing process takes about 15 minutes in total. Once we send the lab to Quest, it can take anywhere from 24 to 72 hours.
But to get a spot in line, it is not as simple as just showing up. The clinic is following the Kansas Department of Health testing guidelines. You will need to call Grace Med and go through a phone screening. If you qualify after that, they will set your appointment.
I think it's important to realize that not everybody who wants to be tested really qualifies.
Once you are in line, you will get tested for the flu and bronchitis. Results will come back while you wait, and if they are negative, employees from Grace Med will swab you for COVID-19. Dr. Elder says they go through all these hurdles to conserve tests and to make sure each person gets the right diagnosis and treatment.
That's part of that triage process to help identify folks that may have something else going on. You know, it's allergy season, so we're starting to hear a lot about that, allergy type symptoms.
And I know allergy season is a big issue in my house too. We've been like, why did this have to happen now? But as we look at this testing issue, I know that you and I both have gotten people very concerned that we're not testing enough.
Right, and the test kit shortage is important. I think the federal government is issuing packages and test kits to each state. We got to make sure that they get to the population centers. In the private testing is good, but that usually requires if you have insurance and you have your copay, a lot of those things. So, and I'm glad the pre-screening that's going on seems to be a really requirement than just there's a curiosity. Can I be tested? And if you don't have any of the symptoms, then they're deferring you.
Well, and as we look at the testing too, we know that you guys announced, the commission announced today that Sedgwick County is now a community transmission county. We have more than 5 cases where we don't know where they came from.
Correct.
When Johnson County went there, they changed their testing priorities for Johnson County. Is that happening in Sedgwick County as well? Do we know?
Yeah, I'm not aware of that yet,
No.
but it changes hourly.
Yeah.
So.
That is very true. Everything on here is changing hourly. And again, as we're talking about testing, I want to go to you, Jeff. There is a difference between testing for mitigation, testing to treat people, which is kind of what we're doing right now, and testing to figure out just how widespread this is. Can you explain that?
Sure. I want to first say one thing, which is under the under the second bill from the federal government, testing is free. There are no copays. If you do not have insurance, the federal government is going to be paying for that. So that's something that we got rid of early on. There are now several companies that are able to do 1,000 tests a day, and that number is going to continue to ramp up as hospitals come online with their own testing systems. And so having that testing is going to be important, and then it is easier to use in the community place. Right now, why we're seeing the restrictions on that is because they're trying to just limit testing to high-risk individuals or certain patients. The other thing that's out there on testing is when you are tested, you're only tested and you're only showing that you're negative that day. That doesn't mean that you're immune to this in the future. It just means that that day they did. Now, also in China, they found that there was a high risk of about 10 to 40%, depending on whose study, that test could be flawed. In other words, it could be flawed because of a problem of how you took the test. It's not just a simple little swab in your nose. It goes back 3 inches inside your nose, and that's a pretty uncomfortable thing, but it has to get back to the nasopharynx. The medium has to work properly, the timing has to be done right, and the reagents all have to work. So, originally in China, they were having a lot of difficulties. We're seeing that we're curing that problem now. But there's also there's a blood test that is coming online that is being approved, and that blood test actually shows whether or not you have the antibody to it. That is, you've already had the illness, not say that you can't give it to somebody else, but it says that you are defending your own body. And that having that test is going to be very important over the next year or so.
Now, have we figured out yet whether or not the immunity from COVID-19 will be like the immunity from the flu, where it only lasts for a year or so, or the immunity from chickenpox, which once you've had it, you're immune for life?
Well, the immunity from the flu is really, you're still immune to the same flu. It's just a different version comes out every year. And normally every year there are a couple of dozen different strains of flu. And so you have to build up a new immunity to that new strain. We have concerns of whether or not the current coronavirus could mutate and have different strains and become like seasonal flu. We don't know that yet. We do believe that, like most viruses, when you get COVID-19, when you have the disease and have recovered, you are generally immune. And we don't know whether that is for a lifetime or whether it's for a year, but generally you're going to be able to get back into society again.
Okay, I'm going to break away real quick from the medical aspect, because one thing I wanted to talk about is on Friday, the president signed a relief package
Today.
For the public. Well, but this doesn't air just on Friday, so.
Okay. Good point.
And I know that you have been following that very closely, Phil. You've read the entire
the
summary of it.
The summary the legislators got.
Which is 36 pages. That's plenty long.
The short summary is there's a lot in that bill for Kansas. There's relief for community banks. There's relief for the aviation industry. There's support for both private and public airports. There's support for manufacturers to help with extension of partnership programs. There is help for farmers and ranchers. There's support for veterans and additional funds for the Veterans Administration, like the Bob Dole Hospital. There's increased food access. There's $450 million for emergency food assistance program that goes to, like, our local food bank. Support for critical research. There's billions and billions of dollars going to the CDC now, and for resources such as the possibility of research into vaccines and diagnostics and other medical needs. There are $16 billion for medical supplies, such as the environmental suits, masks, gloves, and all those things that we all know are in short supply. There's also support for healthcare providers. There's $100 billion in direct assistance to them that are treating COVID-19 patients. And then, most importantly for our business community, is there's significant modification of the Small Business Administration. There are going to be grants, there's going to be loans that are going to be forgivable if they keep all their employees in place and don't lay anybody off. There's also significant expansion of unemployment benefits for those, like, that are working in retail food service, that, there's just no way they can keep them all going. So I really think that other than the one no vote that said I want a roll call vote in the House, it was unanimously passed in the Senate Wednesday. It was all but, it was passed on a voice vote, so that's going to be technically unanimous in Congress. I think that it's important to note that despite the partisanship we see on so many levels in this country, that on the whole, with limited exceptions, that has been put aside. I mean, I was on the conference call with Senator Pat Roberts, and he said that our governor, Laura Kelly, was doing a great job. And, I didn't hear anybody gasp or cough on the other end of the conference call. And then I saw some limited acknowledgement by the Democrats in the House of because this is a Senate bill, and this bill wouldn't have happened without the Republican majority supporting it. So, there's hope. I think that on the whole, that this legislation will help at least change the arc of the curve that we see in the economy, with over 3 million applications for unemployment insurance last week. It's historic. It was never like that in the Depression either.
Yeah.
But I didn't see anybody do a proportional, like, per capita one. So yes, this legislation is really important, and I think it's going to be critical. And I think everybody needs to learn about it and get on board with it. And let's keep the economy going.
Critical for the entire state. Certainly critical for Sedgwick County. I've heard estimates of losses of upwards of $1 billion for the county with all these closures.
Well, and I thank the judge for helping summarize. This is fast moving, as we know, and I think one of our next steps that we need to do at the county and with the media is provide the links. How do you get in line for some of this
Yeah.
If you're a small business, if you're a worker, health,
Yep.
not the health workers, but the ones that are laid off, and especially the service industry, the waiters, waitresses, the bartenders, those that rely on.
It's got to be tough for them. And,
Right.
you know, there's also the individual check that's coming for everybody that makes less than $99,000 a year.
No.
So, you know, they're going to get, they say that the Secretary of Treasury said that they're going to start direct depositing them in less than 20 days.
That's
That's going to
warp
be
speed for the federal government.
That is warp speed. So, you know, some of us may be getting checks, but, you know, almost everybody else is going to get a direct deposit.
So, Judge, did you find, so I know that previous there was kind of direct orders from the federal to the state capitals, even timing, like you're saying, 20 days on this and that. But there was a question when we talked to the National Association of Counties, they're not convinced that the capitals of each state are required to hurry up and get it out to the population centers, the counties, the cities.
Well, of course, every state operates, I presume, like Kansas, where they have an appropriations bill, and I don't have the detail orientation for what has passed in the state legislature, but I expect they will be going back very soon. They're talking about going back and wrap up about the end of April. I don't think we're going to have the shrimp peel this year, darn it, but because that's kind of like old home week for legislators that used to be there. And you know, I know they're going to get things done. I know I was working with legislation to help with like a 2-week unemployment benefit in Kansas if you were told to stay home. And the feds got that one and kind of preempted it. But you know, we're working on legislation with them too.
All right. Well, one of the things, I'm going to interrupt there because we got one more thing I really want to talk about in the show. One of the things that you had mentioned was more funding for medical research. Obviously, a big deal when it comes to trying to fight this. I know Dr. Colyer has been instrumental in highlighting the potential helpfulness of an old drug in fighting this new virus. You've probably heard of it by now, hydroxychloroquine, originally used to fight malaria. Doctors around the world have been using hydroxychloroquine, also known as Plaquenil, to treat symptoms of COVID-19. Dr. Colyer and Dr. Daniel Hinthorn, the director of the Division of Infectious Disease at the KU Mid Center, wrote that the drug isn't a silver bullet, but if deployed quickly and strategically, the drug could potentially help bend the pandemic's hockey stick curve. They say when used alone, it cleared the virus in 3 to 6 days, compared to the average of 20 in China, reducing a patient's ability to spread the disease. In a small-scale study in France, when used with Z-Pak, also known as the antibiotic azithromycin, it had an even higher cure rate. However, another small-scale study in China showed a statistically insignificant difference in the illness between patients who received the drug and those who received no treatment at all. And Jeff, I'm going to go straight to you on this one because obviously you were a major author in promoting this, the usage of hydroxychloroquine, and there are a lot of questions related to it. One of them, that study in France that the article mentioned, has since been derided for not being big enough, being even smaller than the 30 people had originally said. Where do we stand with the research right now?
Yeah, so that study is really a very large case report. It's also based on a lot of test tube study that is also underlying this there. What's interesting, though, is literally as we are speaking here, they have released the follow-up study to it, which has another 80 additional patients that show a positive result. I haven't been able to go through the data literally in the last 5 minutes it came out, but I've seen the basic summary of it, and it shows that it does continue. The issue for us is this, I normally would want every last study that I can, but we're in a different universe right now. This is the only thing that we have that there is good science on that has an immediate effect and is widely available. I think this is something where, as we look forward, it could be wrong. We're seeing more and more data that it is positive, but it's not a positive as a magic bullet, but it's something that could help us very strongly overall.
I'm going to jump in on something there. You said widely available. Now, hydroxychloroquine is known commercially as Plaquenil, which is a drug that is used to treat lupus, amongst others, which, if not kept in control, can be deadly in and of itself. And I know folks who have lupus right now who are already struggling to get hold of it because doctors are holding it back, wanting to save it to fight COVID-19. How do doctors make that decision?
It's actually not doctors making that decision. It is pharmacy and wholesale pharmacies are trying to distribute it as they get access to resources. You're going to see, I've already spoken to several manufacturers. There are actually additional Plaquenil that is on its way to Kansas as we speak. Those who are on the drug as a regular part of that, we need to ensure that they have adequate supplies. And I'm very confident that those supplies will be adequate over the ensuing several weeks. We're seeing lots of work from the national side to make sure that we're drawing down from stockpiles. A number of manufacturers have actually donated millions and millions of doses already, and they're getting them loaded up and they're getting them distributed around. Then it has to get out into the hospital system and the pharmacy system. It takes a few days there, and I do think there is, immediately a shortage right now, and so we need to be cautious. We need to use it for patients that are extremely high risk, those who already have the illness, already have lupus or something like that.
And one last question as we're looking at this, we're starting to run out of time, so short answer, please. But as we deal with this, we know that the FDA has approved the use under what's called compassionate use. Can you explain that term for us?
Sure. Actually, most prescriptions, you think it's prescribed specifically for high blood pressure. About 1 out of 5 prescriptions are actually called for off-label use. That is, it's not fully documented and released by the FDA for that use, but about 1 out of 5 prescriptions in the United States is used slightly for something else. A related condition doesn't have all of the full literature done yet. Compassionate use is a way of allowing people the opportunity to try in an unusual, extreme situation.
All right. Well, thank you so much, Jeff, as well as Phil and Pete here on the desk. It's been a very interesting conversation. I appreciate the input all three of you have had. I hope that you too have found our discussion useful as we go through these concerning times. If you have questions we haven't answered, please find us on social media. Look for KPTS Channel 8 or Pilar Pedraza TV on Facebook, Twitter, and Instagram. For now, stay safe.
Southwest National Bank has proudly served Wichita and its surrounding communities for over 100 years. We are happy to support KPTS, Public Television for Kansas.